Hello friends, today we will talk about Covid-19. Covid-19 is a viral infection, and in this video we will discuss about different type of symptoms of the virus infection and how the virus transmission occurs from one person to another, and what is the difference between normal COVID infection and normal flu. And firstly we will start that the common symptoms of COVID-19 are fever, tiredness and dry cough. These fever are almost similar in other type of viral infection like influenza, but in case of COVID-19, in severe cases, there is problem and difficulty in breathing, and most of the people recover after few days. Rarely the disease is serious and even fatal for older people and the people which have some medical conditions like asthma, diabetes and other type of cardio problem. Some other symptoms of COVID-19 infection are sore throat, headache, diarrhea, and in some cases loss of smell and taste may also persist. And according to WHO, the incubation period for virus persists up to 14 days. And now it is very important to remind that what is the basic difference between normal influenza infection, normal flu and COVID-19, because the symptoms of both the infection are almost similar. In case of normal flu, the fever, the dry cough will recover within 3 or 4 days. But if the patient is infected with COVID-19, the symptoms of the infection of virus persist for many days, and these are mainly required for test of COVID-19 and under medical condition and treatment of doctor. Majority of people of coronavirus infection will recover after rest and by the use of paracetamol. Some people of COVID-19 need hospital treatment which generally shows difficulty in breathing, and generally doctor may scan the lungs and give treatment such as oxygen or ventilation if needed. And it is important to remember that according to WHO, World Health Organization, the patient of COVID-19 are basically divided into 3 different groups. About 6% patient of COVID-19 generally shows critical illness like lung failure, organ failure, and they generally shows risk of death. About 14% people which develop severe symptom and difficulty in breathing and shortness of breath. 80% of infected people of COVID-19 generally shows mild symptom, fever, cough, and some have pneumonia, and these are generally recover within a few days. The transmission of COVID-19 mainly occur through respiratory droplets, and these droplets are generally expelled by someone during the coughing, sneezing or spitting. Thus the good respiratory hygiene, cover your mouth and nose with your bent elbow or tissue when you cough or sneeze, is very useful. Dispose of used tissue immediately. These droplets are too heavy to hang in the air. They quickly fall on the surface or floor and contaminate any type of surface. These virus particles are mainly transmitted from one person to another, either during the breathing or by using or touching the contaminated surface. You can be infected by breathing in the virus if you are within 1 meter of a person who has COVID-19, or by touching on contaminated surface. When touching your eyes, nose or mouth before washing your hands. Thus, it is very essential to wash your hand properly or use alcohol-based hand sanitizer. And it is very important to remember that the respiratory droplets are the main reason for spread of the virus from one person to another. Be remember that these respiratory droplets are very much responsible for transmission of COVID-19 from one person to another. And please like, subscribe and share my video. Thank you.